First up tonight, the push is on to get more people vaccinated as the COVID-19 numbers keep going up. New numbers out late this afternoon actually reveal our positivity rate is now getting much closer again to 3%. Since yesterday, 391 more people have tested positive for the virus, and there are 103 people now in the hospital.
And these numbers have public health officials very concerned. The CDC came out and urged people in COVID hotspots to wear masks indoors. But how do you know if your city or town meets that criteria? Channel 3 Eyewitness News reporter Mike Savino took those questions right to the experts. He is live right now in West Hartford with some of those answers. And Mike, what did they have to say about this?
Well, Mark and Aaron, if you recall back in the fall, we relied heavily on the 14-day average of cases in each town to decide whether or not they were in a red alert. But some local officials say that those numbers can be thrown out of skew by a small cluster, especially in small towns. So the governor told me today that he wants to give those officials flexibility to take that into consideration.
We're not looking to change anything at this time, pending the results of the next report.
Some basic numbers make it look like Franklin is seeing a surge in COVID cases, an average of 26 positive cases per 100,000 people over the last 2 weeks, and a positivity rate over 11%. But in a small town, 7 unvaccinated people testing positive for COVID can skew the numbers.
So you get a little spike like this, and it has a dramatic effect.
Back in the fall, Franklin's 2-week average would meet the criteria for a red alert, an average of 15 cases per 100,000 people. The Department of Public Health says Salem would also meet the mark for a red alert, while Andover would be in orange. So are they one of the hot spots where adults should wear masks indoors, as the CDC said Tuesday?
If you step over the border from some of those signs, you're not as high risk. And that doesn't make a lot of sense.
Doctors agree we need to look at more metrics to look at community spread, as well as the vaccination rate. So they want the CDC to provide more information on what makes a hotspot. Governor Ned Lamont says he's looking to give guidance, but it won't be as strict as last fall's rules.
I know everybody says if it gets above 6.72%, then there's this rule versus that rule. You know, there'll be guidelines, but not going to be rigid.
Meanwhile, Governor Andrew Cuomo is requiring New York State employees to get vaccinated or take regular tests. Lamont says he's not ready to do that in Connecticut. In fact, he's not sure he has the authority.
I think I have to sit down with the state employees and talk to them.
Lamont was also critical of the Food and Drug Administration for still not voting on whether or not to give full authorization to each of the 3 COVID vaccines. He says that delay is causing some people to be reluctant to get their shot. He would prefer if people just chose to get it on their own. Live from the mobile newsroom, Mike Savino, Channel 3 Eyewitness News.